Which is better, yoga or PT? Dr. Nicholas Mercer with uImproved PT. A lot of people have found a lot of benefit to their lower back pain when they do yoga. But what does the research tell us about yoga's effectiveness on back pain, especially in comparison to other options like physical therapy or just education? Well, one study looked at exactly this. Well, specifically, they looked at chronic nonspecific lower back pain. So chronic meaning it's been going on for at least 12 weeks, and nonspecific meaning there's no clear cause like stenosis or a herniated disc. Now, in this study, they looked at primarily low-income, racially diverse people, most of whom were actually female. And basically, they had a very, very in-depth study put together. They had education for the yoga instructors, for the patients who were in the yoga group, and extensive education for the PTs who were in the PT group. For the group that they just got education, they got a handout that they had to read through, and which kind of guided them through some strategies on alleviating their pain. Now, if you want to look at all the specifics for this study, I will link the PubMed ID in the description below. Essentially, what they found was that the yoga intervention, the specific yoga intervention that they used in this study, was not inferior to PT. All right, so like, what the heck does that mean? It basically means that their yoga protocol, their yoga intervention was not worse than PT. Gets into kind of the weird language that we have to use in research, but essentially that's what that means. Another result that was very interesting was that both yoga and physical therapy were found to be better at alleviating people's pain, at least the participants in this study, than just the education group. And after a year in participants who were adherent to what the researchers told them to do, either yoga or PT intervention, actually maintained those improvements past the 1 year mark. The authors concluded that a structured yoga program for patients with this chronic non-specific lower back pain might be a reasonable alternative to physical, depending on availability, patient preference, and cost. Now, before you go telling all your friends, oh yeah, yoga is just as good as PT, there's a caveat here. Just because this study showed that their yoga intervention was not worse than PT doesn't mean they're created equal. This doesn't mean that just practicing standard yoga that's outside of this protocol every once in a while is going to help your lower back pain. That is not what this study is saying. The researchers had a very specific protocol for the participants in the study, along with highly specialized yoga instructors taught to implement this protocol, and PTs who also took a very specific approach to each participant. Now, what this study does highlight is the importance of just maintaining generalized lumbar mobility and stability throughout your everyday life. Essentially, maintaining a healthy lumbar spine. It also highlights the importance of improving these factors if you're already experiencing lower back pain. Again, these results can't be generalized to all lower back pain. It can only be generalized to chronic and non-specific lower back pain. Now, another thing this study did not do was include some other effective PT treatments such as manual therapy, soft tissue mobilization, and joint mobilizations. So that may have skewed the results a little bit in the favor of yoga. I actually went in and looked at the protocol for the yoga participants, and a lot of those movements are movements that I actually prescribe my patients. Now, I don't have hardly any experience in the practice of yoga, nor the teaching of yoga, but a lot of yoga movements, yoga stretches, and poses are similar to what we would prescribe in physical therapy. And I prescribe some of these movements to my patients pretty much every day. With that being said, I'm going to show you 3 exercises that were included in the yoga protocol for this study. And there also happen to be movements that I frequently prescribe my patients. Remember, this is not the entire yoga protocol, and I am by far not a yoga instructor. But many of my patients have benefited from performing these yoga exercises in the clinic. All right, first we have child's pose. If you can, you're gonna sit on your heels, knees on the floor. You're gonna stretch forward, and the goal here is gonna be to try to round your lower back as best as you can.
And we're gonna pull that belly button in and take some nice deep breaths here. Inhale and exhale. Inhale and exhale. You should feel a little bit of stretching in your lower back here. We'll hold this for about a minute and do that a few times throughout your day. The next yoga exercise I'm going to show you is the Cobra Pose. So all you're going to do here is if you start on the ground, just like this, you're going to try to push up and let your lower back extend, okay? If you can't do this, or if it's uncomfortable, try going down to your elbows and try to extend through your lower back here. That should help you out too. If this increases your pain, don't do it. And again, we'll just hold these positions. We want to try to get as far into extension as possible. We'll hold these positions for about a minute and do it a few times throughout your day. So next we have cat-cow. Don't ask me why it's called this. I don't know. But we just practiced lumbar flexion, we practiced lumbar extension. Now we're going to practice controlling both of those movements. So we're first going to go into flexion. Again, pulling that belly button in as you do this, trying to arch your back, trying to round your back as much as you can. And then we're going to go into extension. Here, trying to arch your back the other way, extending through the lower back. And then back to the flexion, okay? We'll spend 10 seconds in each position and do each position 10 times, probably doing 3 sets throughout your day to start controlling these lumbar movements.
So it's interesting to note, these movements focus primarily on lumbar mobility and stability, but they don't take into account your specific situation. And of course, if any of these exercises increase your pain, don't do them. Go to your primary care physician and get the help you need. But if some of these exercises did help you with your lower back pain, that's awesome. Remember, there are no magic bullets. There's no one movement that is going to fix your pain, but there are some movements that we can do that can help alleviate your pain and get you moving better. If you like this video and you want to see more like it, please subscribe to our YouTube channel. You can also check us out on all of these social medias. There will be a link to all of them in the description below. And remember, it's a prerequisite to move well, because once we move well, we can move more, pain less.